Good morning, dear students. Today we are going to start our topic, our class with the heading Diseases of Dairy Animals. In the last class, we have seen about different types of animals, how we need to select our required breed, and what are the foods we need to give. So, in this section, today's section, we will see about the diseases that is affecting the dairy animals. First is cattle lice. Its picture is shown here. What it causes? It causes irritating bites in the cattle, and its menace is more. It's abundant in winter seasons. Then, what are the symptoms? Whenever a dairy animal is suffering from this bites of this cattle lice, they will continually rub its body against some fences to relieve out of it, and also the haze appears so dry and dead without any life, and also milk production also start to decline with the progress of the infestation. So these are the symptoms. It will rub, haze appears dry and dead, milk production decline. Then what is the prevention? How we can prevent? Only thing we need to isolate the affected animals, and also we need to maintain the cleanliness of the premises. So that's about cattle lice. Acid bite, animal start to rot, haze become dried out, and milk production decline. So we need to isolate and maintain cleanliness. So next, another menace is ringworm. Ringworm, as it affects this animal's body, have some patches here and there, mostly in the face. It is a contagious skin disease caused by parasitic fungus. Fungus causes this disease. What are the characteristics of this infection? We can say circular or oval patches covered with the scabs. Scabs means it is a hardened skin that form over wounds. So such patches we can see mainly around the sides of the neck, eyes, and the head. So, and it is more frequent in calves during winter seasons when that calves are undernourished. Then what's the mode of transmission? Through contact. How we can prevent it? Only thing we need to isolate the eye affected one, and also wash all the affected areas with the soap, and also we need to apply tincture, means small amounts of iodine. We need to apply iodine. So that's the preventive measure. So that is ringworm. As a name, it's came to your mind. This picture should come. You need to remember the scabs, patches. Patches we can see in the face side of the face, near to the eyes, like that. Then next is ticks. Ticks, common ticks that is causing problem for the dairy animals are Buphalus australis. This is Buphalus australis. Hyaloma egyptium. This is Hyaloma egyptium. Hyaloma egyptium and Buphalus australis. Buphalus australis. So they are the common ticks. What's the effect it causes to the dairy animals? It sucks the blood. As it's continuously suck the blood, it will result anemia. As anemia start, then that animal become uneasy. Emaciation means general tiredness. It's not having enough strength and stunted growth. Working efficiency of that animal also highly reduce as the infection progress. So these are the effects: anemia, uneasiness, working efficiency reduction. Then how we can control? By the application of tick killing solution. How we can apply? Using brush or spray pump. So that is the control measure. Then next one, mites. It causes sarcoptic mange or cattle scab. Scab, what I already explained to you. There are certain hard tissue that is forming over wounds. And sarcoptic mange means some skin infection. Why it is called sarcoptic? Because this mice comes under the family Sarcoptidae. So it's called sarcoptic mange or cattle's cap. We can see that image. Oh, it's very disgusting to see. Means it happens because as a result of that infection, the animal continually scratch its skin. So that's why the skin become in this form. So anyway, infection. What is the nature of that infection? As the mite enter means it enters the body, as it comes the body of the animal, it spend its entire life cycle inside the body of that dairy animal and feed its lymph, and as a result of that its skin become tough and wrinkled. Then how it is transmit from one animal to another? Through contact. Symptom, that animal continuously rub and scratch the skin. Then how we can prevent? By isolating the infected animal and also disinfect. We need to disinfect the infected premises where all these mites may present, and also all utensils also we need to disinfect, and also we need to take assistance from a veterinarian. Next, we are going to see about the diseases that is caused because of internal parasite. That parasite that enters the body of the dairy animals. First one, liver fluke. 6 species of liver fluke exist that are causing infections to the dairy animals. How they infect? When a dairy animal it graze over the grass that is infected by this liver fluke, that animal get infected. What are the symptoms? That animal will lose its interest to feed. It show slow and irregular rumination, labored means difficult respiration, reduction in milk yield. These are the symptoms. Intermediate host are snails. So we need to eradicate the snails. How we can eradicate snails? By introducing ducks and geese in ponds. That is a preventive measure. And also we need to keep away all our dairy animals near to the marshy places. Next is coccidiosis. We have seen this one in the case of poultry diseases also. So, in the case of dairy animals also, coccidiosis disease is there. This protozoan parasite is causing an infection. What's the name of that parasite? Coccidia. Then what is the reason for the infection? Yes, reason is poor sanitation and management condition. What way we are managing our cattle, that results this infection. What about the infection? This parasite enters the digestive system of young calves. Digestive system of young calves while it drink contaminated water. So during that time, it infect the dairy animal, and it is more common in wet season. So wet season is always be the culprit. Symptoms. What are the symptoms? Loss of appetite. That's a common thing wherever, even if in the case of human, if we are affected, if we are having some disease, we surely lose our interest to feed, or we will lose our appetites. That symptom we can add along with all type of diseases, right? It's very easy to remember. Bloody diarrhea. In the case of poultry, also we have seen in coccidiosis, bloody diarrhea and weakness. How we can prevent this? Through sanitation. Lack of sanitation is the main thing, so that also we can add along with all diseases. Sanitation. Then proper drainage of pastures and yards. Rotation of pastures. That means while we are letting these dairy animals for grazing, We should not allow them to go everywhere. Instead, we need to divide the pastures into different sections, and each section we need to provide them each time. And in that way, we can rotate. We can change the area where they are grazing. That is rotation of pastures. Okay, that is all about the diseases that is caused by internal parasite. Next, we are going to see the diseases due to infectious agents. Which are those agents? One by one, let's see. Rinderpest or cattle plague. It is otherwise called cattle plague. It is a viral disease, virus mediated disease, highly contagious. It is common in India. What is the characteristics of this disease? Once the dairy animal is affected by this virus, they will have fever, diarrhea, lymphoid necrosis, high mortality important, and also certain ulcers will develop in the mucous membrane of lips, gums, and outer surface of the tongue. These are the symptoms. How it will transmit from one animal to another? Through saliva and dung. Through saliva and dung. What is the treatment? There is no effective treatment. Only thing we can give anti-rinderpest serum. That only we can administrate. Anti-rinderpest serum inoculation. This is the only treatment. That's about this rinderpest or cattle plague. Next is hemorrhagic septicemia. Next is hemorrhagic septicemia. Which is the causative agent? Pasturella multocera. Its picture is shown here. Which is a vulnerable time of this Pasturella multocera, its mediated infection. It is during the rainy season. Even if that vulnerable, most prevalent time is rainy season, but it occurs sporadically. Sporadically means occasionally throughout the year that infection is present. That infection is a problem for the dairy animals. How it transmit? Through ingestion, means through taking food, or inhalation through breathing. And also it can be transmit either due to direct contact or through feeding contaminated feed and water. What are the symptoms? High fever, hot swelling, where? In throat and the adjacent tissues. The difficulty in respiration is another thing, and diarrhea. Diarrhea. Okay. Next is cowpox. Similar to our chickenpox. It is a viral disease, highly contagious. It is caused by cowpox virus. And also those persons, unvaccinated persons that are means milkers who are handling these cows are also mildly susceptible to this disease, cowpox. Symptoms: mild, high fever is not present here, mild fever for cowpox. And some eruptions you can see over the skin, mainly in udder and tits. Udder means this portion, this is tits. How we can prevent it? By isolating. Isolation is the only remedy. And also occasional washing of the udder with warm water that contains some disinfectant. Warm water containing some disinfectant. Next is anthrax. Anthrax, we all have heard about this disease. It's such a pathetic, dreadful disease that affecting the dairy animals. It is a bacteria-mediated disease, Bacilla anthracis. Sure, death will occur for cattle. This bacteria live in soil, and its outbreak also occur during rainy season. It can affect humans also, those who come in contact with the infected cattle. What are the symptoms? Symptoms: sudden death without apparent cause. So that's one symptom. Then high temperature, bloody discharge, not only not only through the fecal matter, but also through all natural body openings. Swellings on different body parts. And finally, that affected animal will die within 10 to 36 hours. Treatment: Vaccination is there, but that vaccination is not providing immunity throughout its life, only for a season. That medicine is anti-anthrax serum inoculation for the infected animals. Next disease is tuberculosis. It is again a bacterial disease. So we have seen two bacterial diseases so far, anthrax and tuberculosis. This tuberculosis is caused by Mycobacterium bovis. What is the peculiarity? The important peculiarity is that even if this bacteria affects the dairy animals, it will take many months to year to develop clinical symptoms. What are the symptoms? Gradual loss of weight, swelling of joints, labor means strainful breath. Then two more symptoms are here. Short and dry cough and milk. Milk turns watery, greenish, yellow colored. And also quantity wise it reduces. How we can prevent? Isolation of affected ones. Okay. So for all the diseases, we can write the points like which is the causative organism, then what are the symptoms, what are the preventive measure, likewise. Okay. Non-infectious ailment. And means it is not because of any infection, because of some other problem that happens inside the body. First one, ketosis. Ketosis, what is the reason? This occurs because of the faulty, irregular, wrong way of utilization of sugar in the body of dairy animals. Symptoms, loss of appetite, nervousness, and drop in milk production. Loss of appetite, nervousness, drop in milk production. Then the last one, milk fever. Milk fever, when it will happen? When that cow is going to have a calf, or after calving, that time this disease will develop. What is the reason? It's only because of a change in the blood calcium level. Why that blood calcium level change? That balance disrupt, because that time that cow need high levels of calcium to meet the milk production. So during that time, that calcium balance of the blood become disturbed, and that will result the milk fever. So important thing that just before the time of that calving, we need to keep the calcium level in the blood of that mother cow. We should keep it very low. Then only its body learn to absorb more calcium from the diet. Symptoms when a become when a cow affected by milk fever, it become dull. It feels so difficult to move, and loss of appetite in the first stage. And as the disease proceed without any treatment or care, then that cow may fall in coma. What is the prevention? We need to provide a feed that containing a mineral mixture, including calcium, phosphate, and salt. Supplement we need to provide that. Okay, these are all about the diseases that are affecting the dairy. Okay, so with this, I'm going to finish today's class and section. Thank you.
I'm an icon, man. I'm a girl about a 10. I should fuck her in a Benz.